To the clock on the wall, looks like it's 12:30. Time to call this April 28th meeting of the Panhandle Health District to order. And we do have a quorum, and we trust that we can have a quorum for the whole meeting. That would be nice, wouldn't it? I would like us to stand and give the pledge of allegiance to the flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. You may be seated. The first item of business is to call for the public comment session. Is there anyone here today who wishes to make public comment? Thank you. I see that hand. You want to stand? I give you the floor. State your name and you may proceed.
May I go to the microphone?
You may.
Thank you, sir. Thank you, Mr. Chairman. My name is Patricia Sudik, and I'm here to comment on the budget process. I believe you all received an email from me on Monday containing a packet with an executive summary, an analysis, my credentials, and some pictures.
I did not.
You did not? Would you like a copy? I happen to have one with me.
Go ahead. Proceed.
Okay. I can send it to you again, Mr. Thomas, Chairman. Okay. Just so you have a little understanding of why I took the time to do this. My background, I'm a clinical pharmacist. I have a master's in social and administrative pharmacy and a master's in public health with 1 year of epidemiology background. I was a research fellow for the Seattle VA Hospital. In my long career, almost 50 years, I have worked in almost every aspect of the healthcare situation and the healthcare environment, mostly in program development and evaluation, which also includes planning. Over the last 2 years, I have dealt periodically with the Panhandle Health District over the COVID pandemic. And during that time, I started to have some concerns about the operation of Panhandle Health. And last month, when I was at this meeting and I saw the intention to ask for a 2.5% increase in the budget from each county, I even became more concerned. So I put together somewhat hurriedly an analysis. Given there are no annual reports for the last 2 years, for 2020 and 2021, it was a little hard to do, but I've tried to put together an analysis. And I briefly want to summarize that and what I would like to see the board do. First off, they need to develop a epidemic plan of action. There were so many, you were not alone. This health district, Mr. Chairman, was not alone in problems. But we need to look back and develop a plan because as of today, the bird flu has jumped to people in China. So it's on its way. And I think that was the 2009 epidemic that we experienced. We need to have a pandemic epidemic plan in place. And that needs to be done. And one of the things in that, I didn't mention this in my comments, is only Panhandle Health can do contact tracing. That needs to be their number one priority. Secondly, Panhandle Health would like to have the money for the opiate settlement from the counties and cities. I asked the board to have Panhandle Health develop a plan of action. Again, how would the Panhandle Health use those monies? And now, with regard to the 2.5% increase in contributions from the counties, There's no justification for this. I went through, you can roll over money from one year to the next. You do not have to spend all your money in 1 year. And so you had monies that you put against loans that you could have rolled over and can roll over to the next year or the next year after that. So you have money to use for the needs. And so there is no justification.
Your 3 minutes is past, man.
Okay, I think I've got my points, most important points across.
Okay. All right, thank you.
Thank you, sir. Mr. Chairman.
Moving on to the consent agenda, and also then let me comment, as you are well aware, we did not have a quorum last meeting, so you're going to see a lot of issues, situations today where we're going to be doing quite a bit of voting to take care of not having a quorum at our last meeting. So on the consent agenda, is there anything right off that anyone would like to pull for further discussion in the consent agenda? Anything you would like to pull? If not, I would entertain a motion to approve the consent agenda.
Mr. Chairman,
I have a motion from Dr. McLandris
I would second.
and a second from Glenn. All right, here again, we have a motion with a second. So I'm quickly going to just go through anything you want to say about the minutes of January 27th. All right. Anything you'd like to comment about the minutes from March 24? The division reports from March 24. And today, anything? The contracts, do you have any questions about the two contracts that are included in today's consent agenda? All right, we have a motion with a second that we approve the consent agenda as presented there in item number 4 of your agenda. All in favor of approving this, indicate by saying aye.
Aye.
Aye. Opposed, no. Thank you, Tim. We heard you loud and clear. And Tim, please, sometimes I forget that we have someone coming in on the screen. So don't let me forget. If you want to have any comments, have anything to say, don't hesitate to let us know you're still there, okay?
Okay, thank you.
Thank you. All right. The next item on our agenda is the Bonner County Board representation, the ballots, and do you approve of having these ballots counted like we did last meeting, that Eric and Neil take care of counting these ballots and then report to me when they have them tallied? Any opposition to that? All right, and then once I give you the result of the balloting, we will have a motion to receive them. We don't approve them or disapprove them. That's done by the county commissioners, but we will call for a motion to receive them into the minutes. All right, with that, you two folks can proceed with that. Okay, you noticed in your packet that today was, there were quite a few pages in your packet. And there are two policies. One is the personnel policy updates. Here again, there may be a lot of pages, but these policies are mainly to reflect updates just to keep them current. And the other policy has to do with the Home Health Administration. And I will tell you right now, personally, I have not read all of these policies word for word for word. But I will say, I believe I have touched every page and glanced through them, and I especially like the page that gives you all of the contents. And there have been places where I stopped and read quite a bit, and other pages I didn't read entirely. So we have these two policies. What is your pleasure? Do you want to approve them one at a time or by a motion to approve both of them at the same time? It's your call. Or any questions? Well, I would entertain a motion to approve them and call for a second, at which time then we can ask for any questions.
Mr. Chairman, I was happy with both documents. I'll make a motion to approve both the personnel policy and the home health administrative policies.
All right, thank you, Mike. Is there a second?
I second that.
All right, Glenn has seconded that. Now, any other comments or questions? Dr. McLaren?
Just a query to Mr. Duffy, just to alert us to anything that you think that we should be aware of in the policies, any
Thank you.
significant changes or anything that we should be
And
thinking
I think
about.
he's ready to do that. Thank you, Dr. McLaren. Don, you have the floor.
Mr. Chairman, so as we look at both of these, the biggest reason for the policy change has been the change in management of human resources. As you remember, now with the House Bill 316, this becomes the responsibility of the board to manage human resources and manage our employees. So the vast majority of those policies have to do with that, just making that change and make it clear for us. The second is with our home health policies. With our state agency that manages home health, as they do any home health agency, puts the Board of Health in a different leadership role, a direct leadership role as it relates to our policies. So as we have whatever the policy might be with home health, including even some patient care, that requires the board to approve those policies now and any changes in those policies going forward. And I think I can comfortably say that anything you see, we are already doing there, but it does require your approval on that. Mr. Chairman, we have our Michelle, our HR representative here today, and also Jenna, who has submitted the home health policy, is with us today also. And I might, with your direction, give them any opportunity to offer feedback on both of those as well.
All right, Michelle, we'll call on you first.
Thank you, Mr. Chairman. I don't really have anything to add, except that we did add a few policies that we were using the Division of Human Resources policies. We basically took their policies and made them fit our agency, specifically the FMLA policy and the paid parental leave policy. So we really just mirrored what they did and made it our own policy. So those are really the two that we didn't have in place before.
Thank you, Michelle. Jenna?
Yes, Mr. Chairman. So home health policy is very minimal revisions. These are pretty much the same policies as they've always been. As Dawn stepped into district director role and I came on as division administrator, we did have some just administration changes. So those were reflected in these policies. And other than that, it really is formatting. So part of our compliance and quality assurance is to review these policies every 5 years and have those signed off by the Board of Health. So that's what we're doing here today.
Okay, does that help, Dr. Flanders?
Just a question regarding home health. Is there anything in the policy regarding management of response or action plan when you perceive that we're understaffed? Do we have anything in the policy regarding when you know that we're understaffed for home health nurses? Do we have an action plan in the policy, or is that outside of the policy?
That would be outside of the policy. To the best of my knowledge, there is not a policy reflecting short staffing. We do have some contract agencies that we use for therapy and things like that. Right now, we're not using those for nursing, but to the best of my knowledge, I do not believe there's a policy about that.
Okay.
Don?
Mr. Chairman, if I may add to Jenna's comments, we are turning away admits every month in home health due to lack of staffing, and that is not uncommon throughout the all other home health agencies.
I'm aware of that, that's why I asked.
Yeah. And a challenge.
We have people parked in the hospital for months because they do not have care outside of the hospital, including the home health care interaction that keeps them safe and preventing readmission. So that's what I was wondering. Thanks.
Okay, Glenn?
Mr. Chairman, I just had a question regarding HHAP 109, which, sorry. That was HHAP 109, which covers the income-based sliding fee. And down in the protocol, item number 3 says the income-based discounts can be applied to the following situations. Any patient that supplies proof of income and is at or below the 175% level, or whatever FPL is. I was just curious, do you designate what are acceptable forms of proving their income?
Mr. Chairman, I'd love to answer your question. I would really want to defer to our billing department on that. I'm not
Okay.
sure the criteria. Don may have more information on that as well.
Okay, Don or Christine, who wants to tackle that?
Mr. Chairman, we'll have Mr. Duffy do it.
Mr. Chairman, I suspect it'll be both of us as we try to tackle that issue. That's an excellent question, Commissioner, our board member. We first of all, we are very clear at the health district that no one will be turned away from care. Everyone will be accepted here. And we do have documents that they fill out demonstrating their financial need. And actually, that is part of state insurance law that requires such a thing. As patients come in, they must demonstrate financial need for us to allow a discount or a sliding fee, as you read in the policy. And so when they complete that document, that is on file in case we are audited so that we can verify. So we are using the proper documentation for that. And I would defer to Christine if she has something else to add to that.
Something like their tax record for the previous year, I would think, but.
Mr. Chairman, the rules of what we ask for are pretty vague. And we actually don't get that detail on that particular information. We are taking them at their word as they fill out that document.
Thank you.
Anything to add, Christine?
No, Mr. Chairman, I have nothing to add. I was actually thinking more from a program aspect as it relates to Title 10, where there may be more specifics, but I have nothing to add in reference to home health. Thank you.
All right. Yes, Dr. Flanders?
Do we have an idea of what percent of our revenues for care are discounted or written off because of the lack of funds? It's about disparities of care in the community, and where is the safety net? Are we the safety net? Do we keep track of dollars that are, call it, foregone?
That information, Mr. Chairman, should be available in our ERM system, EMR system, Next Gen. It's not currently interfaced with our accounting system, but again, I think this is an area where our billing person could best respond to that.
Mr. Chair.
Okay. Did you have a comment?
Yes, sir.
Go ahead.
Thank you, Mr. Chairman. Back when my previous role, I did track that number regularly. And, it was less than 15% of those that fell into that. I suspect the number today might be, and I haven't looked at it for several months, if not like a year or more. It's probably less than that due to Medicaid expansion, I suspect. But as far as home health is concerned, that number is extremely low because over 90% of the patients we see have Medicare, so they have coverage. That number grows as in our clinical services.
Okay, thank you.
Anything else? Any other questions, comments? You have a lot to say, Doctor. I appreciate your insight and your questions. So, any other comments you have for us here?
One of our staff came to our team in the residency discussing determinants of health and what is our need in our community. And as we're functioning to try to understand demographics change with our population change, I think we're basically the sole entity who can track that. And I think it was great to hear that we've developed a process to do that, and it's about tracking numbers and actually having people on board to track what we're doing. Part of it is our funding to demonstrate that what we in public health are doing with the dollars we're giving have value to the community, and in this case, value to prevent ascending health problems that people have, to prevent hospitalization or even death. So I think for the board to know that the team is doing work to try to figure out what is our community looking like in the demographics. Do we have an increasing population that needs help, or are we stable, or are we having a decreasing population that needs help?
Well, you heard the comments. If at a future date, maybe you could even answer more of these questions in depth at our next meeting. I'm sure you've been making some notes as you've been hearing these comments. And then I need to ask, Dawn here refers to you as Jenna, and I see your name as Jennifer.
I'm both of them, Mr. Chairman.
Oh, okay, just want to make
Jenna
sure.
is short for Jennifer, so either one of those.
Okay, all right, thank you. I didn't want to, thank you. All right, we have a motion with a second on the table. Are you ready to vote? All right, if you're ready to vote all in favor of approving these, the personnel policy and the home health administration policy, indicate by saying aye.
Aye.
And opposed, no. And is so ordered. And you might want to note that we'll continue this perhaps at our next meeting as you talk with Jennifer. Okay?
Absolutely, Mr. Chairman.
Very good, thank you. First, Eric, do you have a tally for us on the election?
We do, Mr. Chairman.
All right. Would you like to bring that? Number of votes cast is 14. Necessary for election for a majority is 8. Dr. Fletcher has received 9, and the county commissioners of the 5 northern counties have elected Dr. Fletcher to be the next board member from Bonner County. There were 3 negative votes and 2 votes that were not able to be counted. Okay? So, I will entertain a motion that these results be entered into the minutes. We're not approving this, we are simply entering this into the minutes. Is there a motion for that?
Mr. Chairman, I would move that we approve, we can't approve.
No, we can enter them into the minutes.
Enter those ballot tabulation into the minutes.
Is there a second?
Second.
All right, we have a motion with a second that this information be entered into the minutes. All in favor indicate by saying aye.
Aye.
And opposed, no.
Aye.
All right, did I hear 1 negative vote?
Was Commissioner Bartling, Mr. Chairman? Commissioner Bartling voted aye.
Gotcha, thank you. All right, we have a motion and I'll give these back to Eric. Don't go very far because you're up next. And you will notice on your agenda that Eric will be involved in both item number 7 and 8 on your agenda. So, Eric, you have the floor dealing with the environmental rules. Go ahead.
Thank you, Mr. Chairman, members of the board. I'm before you today to request for your consideration and approval a resolution that's related to the Panhandle Health District rules. As this board's aware, we have been involved in negotiated rulemaking for the past 3 years, along with most other state agencies, when the legislature allowed all rules to expire. This past December, we were removed from negotiated rulemaking process because of House Bill 316. As we are not a state agency, we could not continue in that process. That leaves some legal uncertainty as to the status of our rules. We have been working with our state and local partners in firming up those rules. This action before you is a matter of reaffirming that we do still have effective rules in place, and this is in a manner that conforms with the Idaho Administrative Procedures Act. It is somewhat of a unique situation because we conform, we're not subject to those rules. However, as they state, there are 2 components to it. The first component is you have concurrence from the governor's office that it provides a public benefit, it confers a public benefit, and it's necessary for health. We have secured that confirmation from the governor's office. The second part is that it needs to be published in the bulletin. As a state agency, we do not have the ability, we have asked, we do not have the ability to publish. Our legal counsel has informed us that this resolution would be an equivalent path. So it is somewhat lengthy. I'm not sure how the chairman would like to proceed.
Well, I'm sure you all received this in your packet and have had the opportunity to glance through it. Do you want Eric to read any of the parts in detail? Or as you have seen this, are you ready to vote to approve and adopt these environmental rules? First, okay.
Mr. Chairman, I do have a question.
All right.
We will be adopting today as temporary rules, and that's part of the process. And as was explained, there's more process out in front of us. Can you tell us what the road looks like ahead of us?
Mr. Chairman, what we're currently doing is we're working with, again, local and again, backing up a bit, these rules are primarily associated with unique issues to our area, the protection of the Rathdrum Prairie Aquifer and the Bunker Hill Superfund site. As you've seen, we've seen some early success with our partners at Kootenai County. They have adopted an emergency ordinance related to the 5-acre rule. We're continuing to, I know that our ICP crew is meeting currently with stakeholders in the Silver Valley to move forward there. I think the goals there, we have strong DEQ support, that those will likely be encompassed in DEQ rules and then contracted back to the health districts for implementation.
And Mr. Chairman, just a follow-up. When we're talking about the locals over in the Silver Valley, obviously Idaho Department of Environmental Quality is one. And it looks fairly positive that they're going to champion this and try to move it forward. But I know a fallback position is still to utilize the county commission level, such as Kootenai did with the 5-acre rule. Okay, I just wanted to make sure I was still tracking on what was in front of us.
Mr. Chairman, if I may add, these rules are strongly supported by the communities that they do impact, as evidenced by the recent efforts of the Kootenai County Commissioners in for all intents and purposes, championing, and putting their resources to work to keep continuity in these protections. And so I certainly appreciate the efforts of Kootenai and Shoshone County, as well as all the other county commissioners.
Okay, Glenn, I saw your hand.
Yeah, I was just going to say, we could go ahead and present a motion and open it up for discussion before we approve it, if that's what you would like to do. Mr. Chairman, I move that this board approve the environmental code that has been presented here as a temporary rule pursuant to Idaho Code 39-416 and 67-5226. And it would remain in effect until either the adoption of the concurrent resolution of both houses of the Idaho legislature or the expiration of the 2023 legislative session, whichever shall occur first.
All right, that is your motion. Thank you. Is there a second to your motion?
I'll second, Mr.
Okay.
Chairman.
Mike is a second. Any other discussion then before we go?
So,
Go ahead.
Mr. Chairman, Eric, so this is pretty much just representing the policies and the programs that you had been following with the legislature on an annual basis. And this would just be putting that down as a temporary until, as was said, the legislature comes up with a resolution to this.
Mr. Chairman, that is correct. This is the same rule set that we've had approved by the DEQ board and has been in front of the legislature for the past 3 years.
Okay, thank you.
Okay. Are you ready to vote then? All right, here, the document that calls for my signature is just one page and a little bit on the next. It should be just about the same as the one you have in your packet. All in favor indicate by saying aye.
Aye.
Vote no.
Aye.
And so ordered, and then I will sign this and get it. All right, Eric, if I may, I did err just a moment ago on this election. I should have included to make it clear that this election for Dr. Fletcher is to fill the unexpired term of Alan Banks, whose term will expire the end of June. So even we have to go through the process correctly. So we have elected him to fill the unexpired term, which means that he will be here for the month of May and June, and then we will have to do this again beginning the 1st of July. So if you could insert that back up where we were talking about the election, that would be fine. All right, Eric, you may continue with your fee increase, and if you would look, the rest of you look on page, I think 175, you will have a copy of what the fees were and what the new fee is, so you know the difference between the two. All right, Eric, you have the floor.
Thank you, Mr. Chairman. I am, again, coming before you to request approval to change 3 distinct fees in the on-site sewage disposal program. At the last Board of Health meeting, there was discussion and comment by Member Bailey on the justification for that. I do have a slide that provides some depth and where these changes for these 3 fees come from. Am I supposed to be able to? And I'll jump ahead a little bit while that's coming up, and it shouldn't surprise the board to know that, you know, we've had challenges over the past few years. We've seen increasing prices, you know, in our field equipment, in our, you know, fuel, in our vehicle maintenance. We've seen a dramatic need to not just retain staff, but also to hire new staff so that we can provide timely and solid customer service to our customers and to our clients. And that has been a challenge. That has been a true challenge. What you have before you, what you have before you is a description of how I came onto these fee increases. The first thing that I would note is if you look at the red number at the top, the total program cost of our septic permit program, our projections for FY23 with the 4 additional FTEs that we brought on to continue to provide solid customer service is about $1,689,252. How I derived the additional $100 fee for new permits, $100 additional fee for repairs, and $150 to the speculative site evaluation is I took that program cost amount and I ran it through actual staff coding on the amount of time that we put into those individual permits. So that percent hours coded, that is actual percent time that we spend with each of those specific permits. I then ran those percentages through the projected expenditures, and that gives you basically a per unit cost. Is that reasonably straightforward? I tried to make it as non-busy as possible. So what we have is, if you look at the top highlighted number, our approximate cost, I'm not going to say these are perfect numbers, but our approximate cost for a new septic permit is about $1,260. Our current fee for that is $950. Our repair permit is $543, and our current charge for that is $300. One clarifying point I'd like to make on that is that in almost without exception, when folks have a failed septic system, they don't have a bunch of money in their back pocket to pay for that. In many cases, they're very surprised. So to some degree, we do subsidize that cost because we don't want the permit fee to be a hindrance for people to come in and start the conversation so we can discuss a solution for their individual issue. And, you know, with the board's approval, I'd like to continue that practice. Speculative site evaluation, our actual costs on that is about $520 per application. So I realize with these numbers, it's, you know, it's $520 for the cost. I'm asking for $550, but at the end of the day, I'm looking at the overall cost of the program, and I want the revenues that we receive to reflect and to cover those actual costs. So if there's any questions.
Okay, thank you. Questions on the fee proposal increases? Yes.
Mr. Chairman. Eric, so this policy, these fees would apply to each county that's within District 1.
Mr. Chairman, that's correct.
And so you're not noticing a difference county by county in the cost of each of these? In other words, it can't be tailored more county per county, or you think this is appropriate?
Mr. Chairman, I do believe that this is an appropriate approach. I think that what we would end up saying, we could certainly consider breaking it down. It would be somewhat challenging to track. The other thing is that I think that we'd see in the smaller counties, an increased fee because there's more travel time. So in our lesser served counties, we would then be asking them to pay a larger fee. Certainly the vast bulk of the permitting that we do is in Bonner and Cooney County. And it helps from a continuity standpoint with our repeat customers, our installers and whatnot, to come in and know that they can go into any office, fill out the same application and pay the same fee. So it helps them when they're providing estimates and costs to their clients.
Thank you, Eric. I just want to know what the logic was behind making it for the whole district. Okay.
Dr. McLandris?
I just thank Eric for the clarity. I think that's really very helpful for us. You can track the numbers and distribute it out and project ahead. And our goal is to help make sure that those people who are moving here, or those developers who are doing the developing, are paying for the public protection of our sole source aquifer. That's the bottom line. And safety outside of the aquifer as well. Yeah.
Commissioner Tim, I'll give you an opportunity. Do you have any comments? You may not have the sheet that gives the existing fee and the proposed fee. Eric?
I have it on the screen.
What's that?
I have it on the screen.
Okay. Did you have any comments about these fees?
No, not with our current growth and what's going on.
Okay, thank you. Any other comments? This does cause a call for action. Any other comments?
Mr. Chairman, I apologize to interrupt, but one thing that I would like to comment on is in the past 2 times we've come to the board with fees, we have been actually requesting reductions in fees. And so I just want to assure the board that, these are unique times we've seen over the past few years. I do an analysis similar to this on an annual basis. If it becomes appropriate to reduce these fees, then I will be before the board making that request as well.
All right. Thank you. And if there are no other comments or questions, you have these figures on this page 175. I would call for a motion that we approve or disapprove at your pleasure.
Mr. Chairman, I would make a motion that we approve the fee changes as here presented.
Is there a second?
I'll provide a second, Mr. Chairman.
All right. Mike gives us a second. Any other discussion? You heard Eric, given this considerable thought and study and among his people of his department. All in favor then of approving these fees indicate by saying aye.
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 And opposed, no. All right.
Thank you.
These pass. All right, Eric. All right, moving on our agenda. Glenn, where are we here? We need a report from Christine over vital statistics fee increase.
Thank you, Mr. Chairman. Eric is going to be a hard act to follow. I did not prepare a presentation. My request was a fee increase for vital statistics, the death certificate fee. Currently, we charge $19.
Okay, let me this will be an action item.
Separate from what we just.
Separate from what we've just done. This is a total separate action item. Christine, excuse me, go ahead.
Currently, we charge $19 per death certificate. $16 of that is a state-required fee. $3 is a fee that PhD can charge. I've been in this with the district for ending 14 years, and I cannot find where there has been a fee increase. I do recall where there was a fee increase from the state, and that's been about 10 years ago. So currently, the district is only charging $3 to prepare a death certificate. I would like to see and propose that the health district charge $6 per certificate. And I ground that on the fact that it costs about $6.50 to prepare a death certificate. So it would be nearly covering our cost. So it takes about 10, 15 minutes for an individual to prepare a death certificate. But then also it takes the financial tech senior to reconcile that month's activity at the end of the month, and then also my review of the invoices that go out to all of the funeral homes. The other thing that has occurred is a significant increase in the amount of death certificates processed. For example, fiscal year 21, the death certificates processed increased 37% over the prior year. And my worksheet here that I had printed and put in my binder, I failed to include the totals and cut it off in the printing process. But a quick calculation, in 2014, we processed approximately 4,032 death certificates. In fiscal year 21, we processed 9,300 death certificates. Large increase, and we're continuing to see the increase. For fiscal year 22, for the 3 months ending, we've seen a 24% increase over last year for the 3 months. So I do kindly ask that we increase PhD's rate from $3 to $6 per death certificate.
So that's your presentation,
That is my presentation.
all right? And
Mr. Chairman, I move that we increase the fee as requested by $6 to $6.
okay. All right, is there a second? Dr. McLanders made this motion as second.
Mr. Chairman, I would second the motion.
All right, we have a second. Any other comments or questions? And I'm sure you'll be able to get the hard numbers in the minutes, even though we don't have them before us right here. Thank you. All in favor of this fee increase, indicate by saying aye.
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 Opposed, no. And you have your request.
Thank you, Mr. Chairman.
So this is a certificate people are just dying to get. And they moved my chair down by you.
In all the years I've been on the board, I don't think this has ever come up, so first time in charm.
It is a notarized death certificate, correct? So
It's sealed. Yes, it's stamped.
Okay. Well, then, Glenn, we're gonna come to you next, and I don't see that we have to make any motions for your presentation.
Mr. Chairman, the status of our meetings is the same. They've all been postponed now until May, so that's when I'll have opportunity to meet on the executive board, and I'll have to give a report, I guess, in June.
Okay.
But
Well, apparently, you don't have any serious problems with which to deal.
no,
That's good.
there haven't been any issues during this last legislative session that we've had to stay on top of.
Okay, well, Secretary, you can just say no report. That's a quick one. Christine, are you ready to share with us some more of your findings and work?
Certainly, Mr. Chairman.
You're on.
We'll start with the, actually, I want to do the cash balance. Stop here. There we go. So we're reviewing the cash history for the month ending March 31st. It's the 9th month in our fiscal year. We ended the month with $4,148,000. That's a change of $893,000 compared to June 30th. It leaves us with 3.72 months in reserves. After we adjust for our board committed funds, our program restricted funds, it leaves us with 3.05 months in reserves. And I'd just like to take a minute to remind everyone that our board committed funds are funds that the board has approved to set aside for future use, such as vehicles, building maintenance, our 27th payroll that's coming up in a couple of years. And our program restricted funds are funds that we receive that are designated for a specific purpose. They cannot be used for general support or in any other program other than which they were specified for use. So we end with 3.05 months in reserves. Our budget to actual, nothing significant has changed since we reported last month. Our total revenue is under budget by $1,500,000. You noticed in the notes to the board that we were under budget in environmental. That was seasonal related. We had been on the uptick, and then when we went into the winter, it did slow down, which is typical. And clinical revenues, those were up by about $132,000, and that is due to the COVID admin fee that we're receiving. That has supplemented those fees. We were also down in home health. This was mentioned earlier. It's a staffing issue. We're needing to return or reject admins at this point. And contract revenue is down about $800,000. So total revenue is under budget by $1,500,000. Salary, and wages, and benefits, total personnel expenditures, we are under budget by $479,900. Keep this number in your mind's eye. We'll be addressing it here shortly when we talk about the budget revision for fiscal year 22. Operating expense is also under budget by $513,000. As we mentioned last month, as far as the contracts are related, being under budget, if people aren't working in the contracts, nothing is getting billed to personnel and or operating expense. So we don't have the money to bill and receive to get this revenue. So they kind of go hand in hand. Also, please keep in mind this variance of $513,000. We'll be looking at that in a minute. Capital expenditures are under budget by $600,000, and That's all related to the large principal payment that we made last summer for this facility, the Hayden facility. We put $680,000 on this loan, and we paid off the Sandpoint facility. Trustee benefits is also under budget by $55,000. And as we mentioned last month, the majority of that is due to the fact that we had a contract last year that we chose not to accept that had a component of pass-through funding in the amount of $80,000. So in total, we are in a deficit of $695,000. When we adjust for the change in our accounts receivable of $198,000, add that to our beginning cash balance, it brings us back to cash ending of $4,148,000. I also want to mention here, this is always a difficult transition for me to make when presenting this. I'd like to remind everyone that we're cash basis. We don't manage our reporting on the accrual basis. So we do invoice our contracts. They do become part of the accounts receivable. So what has been invoiced and not yet received, the cash not yet received, is included up in our fees here. So in order to balance back to our ending cash, we need to adjust for that change in accounts receivable. So that's why I always mention this number here. After adjusting for that, taking into our account our beginning cash balance, we arrive back at the ending cash that we saw in the cash history report. If there are no questions on our budget to actual, I'd like to move on to the proposed revised fiscal year 22 budget.
A question, Christine.
Yes, Mr. Chairman.
Okay. You're referring now to this document?
No,
Not yet?
not yet,
Okay.
not yet. I did not present or prepare a handout for this. We have talked about over the last number of months, we have talked about the payout that we made on both this facility and again in Sandpoint. We actually talked about this last fiscal year, but we didn't take action. It wasn't on the agenda where we could take action on it in fiscal year 22. It was approved to make those payments in July of, was it July? Our board meeting in July? July of fiscal year 22. We actually made the payment in August. So what we need to do now, the funds have been extended, they've been approved, but now we need to adjust our budget to recognize that. And the purpose for adjusting our budget is we need to have the spending authority in our accounting system. I mentioned, probably last year, that in our accounting system, you set your budget there. And if you reach your budget or try to exceed your established budget, payments don't process. So we need to recognize our payment of $680,000, or excuse me, $725,000. So what I would like to do, what I am proposing to do, is salary was under budget. I would like to move what we had previously budgeted in salary, a portion of it. I would like to take $325,000 from what was previously budgeted in salary. Also take $250,000 of what was previously budgeted in operating expense. Move that to capital expenditures, but we still need to have board approval of an increase to our budget of $150,000. So what that would do is it would take our fiscal year 22 budget from $14,190,985 to $14,340,985, an increase of $150,000. So what we're doing again, the total payment made was $725,000. But because we're under budget in the two other categories, I'm shifting that down to capital expenditures and asking for an increase of $150,000 to cover the balance.
Okay, questions on that before we move ahead?
Mr. Chairman.
Any questions?
Mr. Chairman, let me see if I digest this correctly. We have three categories that you're proposing, two categories you're proposing to move. $325,000 of salary over to capital improvement. $250,000 from operating expense to capital improvement. And an increase to the budget of $150,000, which will be applied to capital improvement.
Correct.
Okay, this is an action item. Would you like us to vote right now?
I would please.
You would, all right. Would there be a motion to approve this adjustment?
Mr. Chairman, I'd so move, as I had just
All
described,
right,
and make the motion.
and a second?
Second.
Okay. We have, take your pick. We have a second. Any other discussion?
I have a
Yes,
question.
Dr. McLeod.
With new financing routing / through the county commissioners, if I understand legislative action, when we make an adjustment to our budget, do we have to submit that to our county commissioners?
Not at this point.
We're not creating money, we're just shifting money.
We're just shifting money. The $725,000 was previously approved in prior meetings, approved to be payments made on the two loans. But that money was not included in the budget. So that's what we're doing now. We're capturing that in our current budget so that we can establish our spending authority in the accounting system so that we can continue to make payments through the end of the fiscal year.
Makes perfect sense.
Any other questions or comments? All right, we have a motion and a second on the floor, table. All in favor, say aye.
Aye.
And opposed, no. All right. Christie, thank you.
Now we can move on to the fiscal year 23
Okay.
budget proposal. So, right out of the gate, this budget, the fiscal year 22 numbers do not include $150,000 that was just approved. So that will be updated before this goes out to the county commissioners. I started to do that, and I have the fiscal year 22 budget, I have the revision, I have the less COVID. I wanted to keep it clean and consistent with what we discussed last month. So, as I had mentioned last month, I backed out the COVID expenses from the fiscal year 22 budget. I just took that component, that individual program, and backed it out so that we could have a like-kind comparison between the two fiscal years under what we hope will be a normal year. Last month, we had also discussed the county ask for the general portion of the county funding of 2.5%. After the discussion that we had here last month with the board, we went back and increased that to 3%. So that's part of the difference in this current budget. And that 3% only represents $37,133. And as we progress through this, you'll see the impact to each individual county. So our total budget is $13,029,778 compared to the fiscal year 22 budget without COVID of $12,662,500. Overall, it's a 3% increase. Let's start with revenues. We tried to be very conservative with this budget. Pretty much all funding is anticipated and has been budgeted to be level with fiscal year 22. Our program advances, last year we budgeted 18,000. This year we are budgeting 7,500, a decrease of $10,500. Program advances are those monies very similar to the restricted funds where they have a specific use. This is specifically the CARES Foundation funding that we had received a number of years ago. We anticipate that it will be spent out by fiscal year 23. Licenses and fees, we are budgeting $2,125,900. These are the environmental fees, and we're anticipating the same level of activity as we have this fiscal year 22, but it does include Eric's fee increases. Health services, this would be health promotion and clinical. We're budgeting $2,592,000, an increase of $192,000 over prior year. Clinical, we're anticipating level funding. Home health, we're anticipating an increase in admits with the additional staffing, the new staffing that we hope to get. Contracts and grants, we anticipated that funding would remain equivalent to fiscal year 22 with some minor adjustments, totaling $105,000. Donations and other, we discussed last month. This is mainly related to the rentals that we have in St. Mary's, in Kellogg, Shoshone County, and in Bonner County. It's a $40,000 increase, $40,000 increase. Interest, over budgeted last year, estimating 15,000 this year, a decrease of 12,000. The county aid portion, the general aid portion, last year, the 1,237,770. This year, with the 3% increase, it brings us to $1,274,900. Keep in mind with that 3% increase, over the last 10 years, we've had 3 years where we have not made a request for funding. And I think if we look at that average, if memory serves me correctly, that average increase over the 10 years is 1.65%. The county portion related to House Bill 316 is $1,222,000, and that is based on the fiscal year 21 state appropriation. So in total, revenues $13,029,778.
Okay, Christine, now that 1.65% increase was over a span of 10 years?
Correct.
I'm sorry?
Correct.
Oh,
Yes, Mr. Chairman. Our expenditures budgeted for fiscal year 23. Don spoke to this in detail last meeting. Our objective for fiscal year 23 is to get staff up to 90% of policy. That's what the personnel budget has done. Those who are already at 90% of policy are budgeted for a $1 an hour increase. That's reflected in this. So total personnel for fiscal year 23 is $9,616,000. There was no change in health insurance. It remains at $11,650 per staff member. Operating expense, $2,961,000 compared to prior year adjusted of $3,032,000, a decrease of $71,236. There were some significant things budgeted last fiscal year that are not included. There were one-time fees that pretty much represent that $71,000. An example would be the phone system. We had budgeted approximately $40,000 for the new phone system, which has been implemented. It's been implemented within the last couple of months. The other thing that was a one-time fee last year that we do not have in the fiscal year 23 budget was about $50,000 related to the hedgerow implementation. Not included in this budget that we typically include each year is the continual upgrading of our computer systems, our desktops, that sort of thing. We've scaled back on that. Again, the focus being getting the employees up to 90% of policy. Total capital expenditures, nothing out of the ordinary here. It's down $178,000. We have our loan payments for this facility. And we put in, with no specific designation, $50,000. We did not include cars this year. We did not anticipate any budget for any maintenance in any of the outlying counties, but we did put $50,000 in there for the unexpected. For example, what we have, what we're currently dealing with, and we don't know if it will be dealt with this fiscal year or next fiscal year, but we have a sprinkling system issue in the St. Mary's facility. And if I remember correctly, that's about $20,000 to repair. So $50,000 has been put in there, and I know it's a very conservative amount for the unanticipated. And we have budgeted $10,000 this year, and this is very difficult to budget. It's it can be grant driven, how the grants are worked and how they engage with some of the community partners. If they create an agreement with someone, it may not be an activity that is included in operating expense. It's more of a trustee payment. So it's very difficult to anticipate what those costs might be. This year, we have only budgeted $10,000, bringing our total expenses to $13,029,778. Are there any questions on this before we go to the breakdown and the review of the funding formula and the allocations, population, and property calculations?
Lynn? Mr. Chairman, Christine, as far as operating cost expenditures, the fuel costs are continuing to go up. At what level did you calculate the fuel costs, for the home health care, for the environmental inspections, et cetera?
I increased fuel costs by a little over $27,000 over prior year.
Okay,
What percent is that? Just roughly.
What's this worksheet? Danielle, could you drive for me, please? 27,000 divided by 169, 170.
One moment, sorry.
I'm sorry. I would drive if I had a keyboard.
Sorry.
I used to work for a fellow, he used to be a statistician for Boeing years ago, and the numbers would just fly out of him. He could divide numbers like you wouldn't believe and come up with a percentage
Tell me again.
and an answer. 27,000 divided by 169, 170. 13%.
okay.
Yeah.
We'll be lucky if it's all it is.
I have a
That's
question,
very conservative, okay.
if I could. In reference to earlier comments made as we started the meeting, emergency funds and contingency funds, a plan for a pandemic or natural disaster. I know we have insurance that covers certain things. And you were estimating kind of $50,000 in a fund that could be used for unexpecteds, which I get about 4% of our budget. I don't know if you have history on that or what other counties are doing we would have been in deep trouble if we didn't have the federal government
Yes, definitely.
printing make-believe money to send to us. And
The inflation's gonna eat up a lot of it.
so just a question I think we need to address. I don't know how this projected FY '23 reflects. Are there grants or are there other items that are actually in place to cover for, call it emergency?
What we can anticipate seeing, very similar to what happened after 9/11, is after 9/11, there was a significant amount of federal funding that came out, which led to our public health preparedness department. What we're seeing now is, starting to see, is more funding coming in related to epidemiology. Whether that will specifically address a pandemic type response, I'm not sure. You would think that what we've just been through, that there would be some funding coming out to address a response effort. It's possible, Mr. Chairman, that Mr. Duffy may have more information about that.
Mr. Chairman, if I may, we don't see where there's going to be some funding that would allow us to pool it in case there's an emergency. I don't see that coming. The grants, the sub-grants that Christine mentioned do not provide that to us. But what they do provide to us is better planning for events that might come down the road. We're currently meeting with our own here at PhD, and we're collaborating with the state as well as local emergency management to do what we call an after-action report. What did we learn from the pandemic so that the next time it happens, we will not make the same mistakes and do the same things right again, we hope. So that is an ongoing process, lots of good minds coming together to prepare that report. And some of this grant funding is helping us with that. But there will not be a pool of money that we could jump into, and at least nothing that we're seeing at this time. And Christine's absolutely correct. Just after 9/11, that's when our preparedness department was developed as a result of that. And we are, as she also mentioned, one of the biggest challenges with COVID-19 was the epidemiology side of things, case investigations and those kinds of things. And this funding that is going to be coming will help us to be better prepared for that as well. Hope that helps.
Thanks.
You mentioned we would have been in a very difficult position had funding not become available. And it was getting to the point where I found it concerning, because with the CARES money that came through the state, they were supposed to reimburse us monthly. It was annually. And we had just dipped under three months in reserves. It was getting a little concerning.
Okay, then at what point, and maybe Dawn, this comes in light of what you just said, when she reports we have a 3.05 cushion or whatever months cushion, at what point does that become somewhat of an emergency fund?
Well, Mr. Chairman, that's a tough question to answer. How much should a health district have cash on hand? Is 3 months enough? Is 6 months? Is that the number that we should have? We have a philosophy here that we shouldn't be hoarding that money, that this should be going out to serve our public.
Yes.
So we're careful on the cash on hand that we have available. And we, through several discussions we've had, what is that right number? we're very, very comfortable with that. I'm concerned to use that if we had a significant emergency, if we didn't know that it would be replenished.
Sure.
So I'm not sure, I'm not answering your question, but again, other than to say we're very comfortable what we've decided. Other health districts have as much as 6 months in reserve. And again, we feel like those funds should be going back out and serving the community.
Well, the reason I ask that, going back to Fenton days, he would get really nervous if it got under 2 months.
That's an issue.
Mr. Chairman, if I might, there's two items. Dr. McLander's point to the 50,000 that's put in. What is eerily similar at our county, in Shoshone County, is our budget is about 14 million, and we have in our general fund, general reserve, 50,000. You can never, some years it's just the right amount, and most years it isn't. It's the best guess that we put on it, but from a magnitude standpoint, that's interesting. Another thing that I want to point out, my fellow commissioners and I, many years ago, decided of the months of cash on hand, we had to go more department specific with it. We have certain departments that outlay more cash than others. Public Works, for example, is in the way they purchase and complete projects, we can have quite a bit of money out the door. So we plan for 5 months, which is our auditor's recommended level. However, when we come to the more steady, which is personnel, et cetera, and those things that are in our general fund, we target more just under the 3-month component. So I just wanted to pass that on is the two gentlemen that I work with, we've given it a lot of thought and listened to our auditor and have landed on those numbers.
Okay, is that, Christine, you may carry on.
If there are no further questions on this worksheet, we'll move on. Actually, we need to move to PowerPoint. And I believe I failed to load the PowerPoint. Let's take a peek. You know, Mr. Chairman, I propose a short break while I go move the file over to the O drive.
Granted.
Thank you. I'll be right back.
Get used to this group yet? It's not a bad group.
order. All right, let's come back to order and we go back to Christine. You may continue.
Thank you, Mr. Chairman. I apologize for that little blip. So now we have the PowerPoint, and we'll start with the county funding. County funding did not change as a result of House Bill 316. Still remains the same. The funding allocation is based on 70% based on population and 30% based on property valuation. We just discussed the budget. What we didn't see is the layout in a pie form as far as the revenues are concerned. We can see that 36% of our funding comes from, where does that come from? Fees. And 44% comes from contracts. 10% is the general aid. 9% is the county portion related to House Bill 316. And 1% is miscellaneous other, such as donations. So this slide is the population and valuation change. Fiscal year 22 compared to fiscal year 23. The data source down here in the lower left is coming from the US Census Bureau as of March 2022. And then the State Tax Commission, the Idaho State Tax Commission, provides the property valuation. So we can see that population changed in total for the 5 northern counties from fiscal year 23 to fiscal year 22 by 18,221 individuals. Most of that occurred in Kootenai County with an increase of 12,600, Bonner County being second. I actually expected more in Shoshone County.
It's been a while.
Valuation increased by $5,443,000. Bonner County, their change, $1.173 billion. Kootenai, $4,023 million. Shoshone, $114 million. Benoit, $59 million. And Boundary, $71 million. This slide shows the allocation, how the allocation is distributed to each individual county. Up here towards the upper left corner, we have the general aid of $1,274,903. The general aid as it relates to House Bill 316 of $1,222,000 for total county assistance of $2,496,903. So this is divided into thirds. What we're looking at here is, this is the general aid component, the first third. Second third is the allocation for HB 316, and the last third is the total allocation. So you can see by county, the allocation for general aid is for Benoit, $41,700, $259,100 for Bonner, $55,200 for Boundary, $860,000, Kootenai, and Shoshone, $58,000. That's both for the valuation aspect and the population. This next section is related to House Bill 316. The first component here is related to population. Second area here related to valuation. So the individual allocation by county, 40,000 Benoit, 248,400 for Bonner, 53,000 for Boundary, 825,000 for Kootenai, and Shoshone County, $56,000. For a grand total down here of 81,764, Benoit, 507,500 for Bonner. Boundary, 108,100. Kootenai County, 1,685,546, and Shoshone, 113,901. So what we're going to do from this sheet is we're going to see how that changes from last year. So last year, the general aid component was 1,237,770 in total. We're asking for the 3% increase, which totals the 37,133, bringing the total ask to 1,274,903. You can see the change here by county. So the change is impacted by that property valuation and the population. So I also see that I didn't include the county name. I cut that off. So the first, I'm having trouble driving. Benoit, Bonner, Boundary. So the change to Benoit is $608. To Boundary is $7,460. Bonner, thank you. Boundary is a decrease of $1,757. Kootenai, an increase of $30,100, and Benoit, a decrease of Shoshone, a decrease of $663. Increase, thank you. I'm just batting 1,000 here today, aren't I? If we look at the House Bill 316 component, we will see the change by county here as well. So Benoit has an increase of 26,400. Bonner, an increase of 165,600. Boundary, 34,185. Kootenai, 551,000. And Shoshone, 36,000. And for the individual counties here, we can see the grand total of the change for both the general aid component and the House Bill 316 component. So Benoit County has a total increase to the appropriation in fiscal year 23 of 27,000. Bonner, an increase of 173,000. Boundary, an increase of 581,900. And Shoshone, 37,491. Bringing us back to a total of 2,496,903 for the total ask for both components. This is the quarterly payment that is expected of each county. And that will be included in the budget for your county clerks. So are there any questions at this point?
Well, I can see, Christine, that there are going to be some serious questions when we get among the commissioners.
Such as?
Well, okay, Mike, such as,
We have to write a bigger check, don't we? We have to write a bigger check, don't we? Yeah.
okay,
I think though that my fellow commissioners are prepared. We've been tracking how these bills went through and understand the change. Where the questions might come for whether the differences are a lot larger. There's some big numbers there.
well,
Our services are well received. Everyone enjoys Panhandle Health in our community.
sure.
And the extra 37,000 a year is in the small local market, which is about 42, isn't too bad.
Glenn?
Mr. Chairman, Christine, could you go back to page 3? I just wanted to, for my understanding, page 3, if you go to the total, there you go. The total personnel line up above on expenditures. Don, can we get some clarification on, that's an 8% increase, and what is driving that?
Mr. Chairman, I very much appreciate that question, is what's driving that. This is a challenge that we're facing. It's a challenge that all of the counties are facing, is paying for staff.
Employees.
Absolutely. It's a significant challenge we have and continue to have. To give you some idea, in the first quarter of 2021 to the first quarter of 2022, our turnover rate went from 2% to 10%. And in nearly every case, it was salary. Michelle and I do an exit interview on everyone who leaves, and they don't want to leave, but they're getting paid $3, $4, $6, $7, $8, $12 an hour more at other locations. We had one just today. One of our terrific medical assistants is leaving us to go work at Kootenai Health. Several dollars an hour more at that facility, in spite of the fact that our benefits are better than Kootenai Health. They're leaving. So we just continue to see this exit of great employees due to salaries. And everyone knows this. Every business in town is dealing with this particular challenge. So what we did is we made the decision we have pay scales that we use. We don't pull these out of the sky. We use a system the best system we have to try to, what is the pay rates in certain areas. And the state has done that for us. And they have what's called policy, or you can be above policy, or you can be 1% below policy. But policy is really the average salary for us, for all the positions that we have. For years, Panhandle Health District has been at 80% of policy, 80% of the average. So this reflects moving everyone up to 90% of policy. We're still only 90% of the average.
So you're still being outbid by other healthcare agencies.
That is true, but it is better. Commissioner and I, just before this meeting, we're going through and looking at the vacancies we have. It's so much less than it used to be. And that's because we've put this in place. We've already put it in place with our environmental staff. We instituted this on January 1. We were losing people to our great folks over to Spokane regularly, and we had to stop that hemorrhage. We would not be able to provide the services without it. So we implemented this under really Eric's direction, and that made a change for us. And we're seeing it we're seeing it helping in many part of our departments, but some not so much. You take a nurse, 90% of policy is $30 an hour for an RN. Well, walk over to Kootenai Health and you're going to make $40 an hour as an RN. So we're still not up to where we need to be, but we're okay with where we are. And not just, so that's just personnel itself. And so we hope that our commissioners will understand that as they deal with it. And I remind you that the increase we're asking for is only 3% of 10% of our budget. $37,000. That's all we're asking for, to compensate for this 8% increase in salaries. Well, how have we been able to do that? Certainly, we've been able to do it with revenues. It'll help with the fee increases that you've approved earlier today. But also, the staff you see in front of you, the effort, these poor folks went through the gauntlet preparing their budgets this year to try to keep this to only a 3%. We have positions that we are leaving open. Even supervisory positions, we're leaving open and not filling,
So those funds are available.
so that we have the funds to pass those on to the staff that we have now. And that's helped a great deal moving forward. So these division administrators, Christine, deserve a lot of credit we're asking them to do the same amount of work, in some cases with less staff. And so that's another reason we've been able to do this going forward.
Mr. Chairman.
Yes.
Mr. Duffy and staff, I want to say thank you very much for it, because this is not just about retaining good staff, which we all want to do. It's also about delivering well-needed services. And we know that rolls backwards to these contracts that don't go fulfilled. That's money on the table that needs to be spent in our communities. And in order to keep good people, we've got to be a little bit bolder and make sure.
Okay, any other questions on this? Now, when we are going to approve that this be presented to the counties, we're not approving this. That's done by the county commissioners at the budget hearing. All we're doing is telling Dawn and Christine, you may take this and show it to the counties. Yes, Mike?
And with this approval, you'll have the adjustment of $150,000
Yes,
on the overall
I will update.
budget, on this year's budget.
Well, excuse me, when you say this year's budget, you mean fiscal year 22,
22.
correct?
Yes.
Any other comments or questions? Yes, Don?
Mr. Chairman, thank you very much. And I just wanted to make sure that we understand, if you could go to page 7, please, Christine. The hope is, if you see down there, you see the change under grand total. There's a total there of 850, or excuse me, go up one, under House Bill 316, 814, 800, for each individual county. The hope is that the savings in the indigent fund will cover that. Time will tell.
Yeah.
Right?
To be determined.
To be determined, yes, sir. And so the hope is that will all be covered with that savings. So if that theory is true, again, the only amount that's increasing is that 37,133. And also I wanted to mention, if any of you are willing, next week, Christine and I are going and visiting our county commissioners. So it's through next week. And also our last one is in Benewah County in May. So we're in Boundary County on the 2nd, we're in Kootenai County and Shoshone County on the 3rd, we're in Bonner County on the 5th, and we're in Benewah County on May 9th. If any of you would like to join us, we would love to have you with us, and I can give you more specifics if you would like to join us on that meeting. Thank you, Mr. Chairman.
Okay.
Mr. Chairman,
Yes.
if I could just comment, if you could include in your briefing the personnel loss that you just explained to me, I think that would be valuable information, because the counties understand this as well. They are losing personnel to Kootenai County, to Spokane County, in Bonner County. So they understand that if you explain we had to increase our salaries, benefits, et cetera, to compete in the market, and they'll understand.
Yes, Mr. Chairman, we plan to do that.
Inflation is a vicious animal.
thank you, this current administration.
I didn't hear that. Are you ready to vote? Any other comments, questions? Anything else you want to say, Christine, about this?
Just one small nugget of information. That total personnel cost or the total salary and wages, that increase of $650,000, we didn't discuss FTEs. The fiscal year 23 budget compared to fiscal year 22, the increase in FTE is only 1.04, and that's already been filled.
Okay.
So I have nothing further, Mr. Chairman.
Michelle, work.
That'll be one highly paid employee.
Say that again.
That'll be one highly paid employee. We should all,
Michelle, how many employees do we have here at PhD now?
Mr. Chairman, we have 127.
And there's still a few, not a whole lot, but a few vacancies that you would like to fill. Okay, are you ready? If you want to approve this to be presented to the commissioners, I'll entertain a motion for that.
Okay, so this was the FY '23 draft budget.
Yes.
Okay, Mr. Chairman, I would move that we approve the FY '23 draft budget as presented.
To be presented to the counties commissioners.
I would second.
All right, seconded.
Christine,
other-
have it, Christine.
Do we need to be more specific to state as presented with the fiscal year 22 amendment? Oh, excuse me, fiscal year
That's
22
separate.
amendment.
Okay.
Yes, separate. I apologize.
Okay. Any other comments then? If we're ready to vote, all in favor of approving this as the presentation to the county commissioners? Indicate by saying aye.
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 Opposed, no. And this represents a lot of work, and success be with you as you present this. And may you come out of those meetings unscathed.
I just hope I have all my fingers.
We're a friendly We still have that item.
The budget amendment?
Yeah.
Did we vote on that?
We-
I think we
We
voted.
did do that?
Yes,
Okay.
The motion would be inclusive.
I didn't note that.
yeah.
I was asked to ask.
Okay. So you have on record the two actions from the fiscal report.
Yes.
They've been completed.
Okay, yes, thank you. All right. And we've had the monthly financial report. Thank you, and we'll move on to our director as he has a report for us. Don, you have the floor.
Thank you, Mr. Chairman. This will be quick. Just want to, again, we were very happy that our risk management contract under House Bill 515 will be covered, so we won't have that increase of expense. That would have been significant. We appreciate the state continuing to allowing us to be under their policy. I just want to remind all of you, we have, you just elected Dr. Fletcher to be on our board. He will be back. Again, that's just for essentially a month's term, and he will be back, as well as Glenn Bailey will both be up, and we'll be both voting for both of those coming up soon. Just remember, we asked you last month to consider using the PhD email. As you remember, any email you use is open and public record. So we'd encourage you, if you have any correspondence with PhD, to use the phd.idaho.gov email that you've been provided. My biggest concern is that you may not be getting anything. So I'm keeping Danielle and I are making sure that you're getting the information, but I want to encourage you to be using that email for your own protection. Finally, in your chart on at the end of, I think I've got it on 11. I think all of you do as well. Our chairman asked that we include the org chart, and you can go through that. You can actually see vacancies that we have in that org chart and those that we are attempting to fill. We are hard at getting those replaced, and thought you might be interested in going through that. And not only the vacancies, but how responsibilities have been delegated between the three, between myself, Christine, and the 3 divisional administrators. And I just have that in there for your review. And Mr. Chairman, that's the end of my report.
Well, here you had a chance to say a lot, and you took 30 seconds.
Less is more.
Thank you, thank you. I did ask for Deneen to bring up to date the history of board members going back to the beginning of 1971, and already by the action of today, why it needs another update. But you will find this interesting. I don't think it's in your packet right now, but probably in another month, why we'll see if she can include that in your packet. It's interesting reading for me, and you will find it interesting too. But we do need to keep this board member history up to date from time to time, and you'll see that soon. Okay? Anything else to come before this board at this time? Thank you, Tim, for joining us from way up there today. Good to have you with us. You look good on screen. And
Well, thanks, Laura, let me be able to do it this way. It saved me quite a bit of time.
thank you. All right. If that's it for this time, our next meeting will be the budget hearing in May. And that's usually, a budget hearing is usually around 11 o'clock. Then we offer lunch, and then our regular board meeting will follow the lunch period. All right, hope to see you then. This meeting is adjourned.